Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Measuring the amount of calcium deposit in the coronary arteries can better predict the risk of heart attack or stroke than C-reactive protein, according to research published in the Lancet. Here's some information on coronary calcium. Calcium can sometimes build up in plaques on the walls of the coronary arteries. This is a sign of coronary artery disease. CT scanning is used to determine the amount of calcium in the arteries, and the results are presented as a score. A coronary artery calcium score of 0 means no calcium was found in the arteries, while a score of over 100 means the buildup of calcium is significant. Researchers from Johns Hopkins Ciccarone Preventive Cardiology Center in Baltimore divided nearly 1,000 patients into 3 groups depending on their coronary artery calcium score. These patients all had C-reactive protein levels of greater than 2 milligrams per liter and LDL cholesterol levels of less than 130 milligrams per deciliter, which means that some of them could reduce their heart attack and stroke risk by taking cholesterol-reducing statin drugs, but it remains unclear exactly who is most likely to benefit. The investigators looked at whether coronary calcium score could help clarify who could benefit most from statin drugs. About half of the patients had a coronary artery calcium score of 0, while the rest were approximately evenly divided between those with a score of 1 to 100 and those with a score over 100. During a follow-up period of nearly 6 years, about 3/4 of the heart attacks that occurred in these patients happened among those with a coronary artery calcium score of over 100. The estimated number of patients who would need to be treated with a statin drug for 5 years in order to prevent a single heart attack was 549 among those with a score of 0, 94 for those with a score from 1 to 100, and 24 for those with a score greater than 100. Similarly, the number of patients who would need to take a statin drug for 5 years to prevent either a heart attack or stroke was 124 for those with a score of 0, 54 with a score of 1 to 100, and 19 for those with a score over 100. Interestingly, after taking into account all the other factors that predict heart attack and stroke risk, C-reactive protein did not offer additional predictive value. Today's research highlights the importance of considering coronary artery calcium when determining the risk for a heart attack or stroke, and therefore deciding on the need to take drugs such as statins that may reduce the risk. For Insider Medicine in Depth, I'm Dr. Susan Sharma.